So we will go ahead and get started. Looks like we got a good group of students already join us. So I would like to welcome everyone to the Healthcare Administration mini career chat, and thank you guys for coming today. We have two speakers. We have Kim Mascaro, who's class of '85. She's the Executive Vice President for Confluent Health. And then we've also got Lindsey McCreary, who is class of 2011. She's the Director of Business Development at Team Health. So whoever would like to start us off with this chat can go first, and we'll get started.
Well, hello, I'm Kim Mascaro. She said, I graduated from Center in 1985, which is probably before your parents even graduated from college. But either way, I do have a Center grad myself, class of 2013. And so he's out in the working world too. And I just was telling my colleagues here that I connected with another Center student yesterday to talk about what her plans were and what kinds of things she might be able to do. So as I understand it, you just want to know a little bit about kind of how I got started and kind of what my career path was. And then I'm happy to answer all kinds of questions. It's a little strange talking to, I'm glad Lindsey's face is on there, because otherwise I'd be like a movie star looking into the camera. Anyway, so I did math and economics undergrad and knew that I wasn't going to do anything with the math. Math just gave me a lot of credibility that I was smart and could do math. So that was probably the biggest thing that math helped me do. I was also very good at budgets. I mean, I could quickly look at numbers and know if things made sense or not, which is always so impressive to people that, you know, get out the adding machine because they can't estimate, or adding, that dates me, gets out their phone calculator because they can't estimate. But I was a math and economics major, and while I was at Center, I worked in the summers as a nurse's aide in a nursing home, and I did banking as a teller. So those were kind of this is long before we were all doing internships like everybody does now. Those were my internships. So I got my internships in healthcare and in banking. So that was the business of healthcare is what I wanted to do. I worked in the insurance. I took a job that was probably the less, I had offers in banking, or like retail banking, and then an insurance group. And Megan, is it Megan? I'm sorry. Anyway, it's
Brianna. Yeah.
Sorry, it's Megan Milby that always emails me.
Yes.
So just give me the 2-minute warning so that I don't get everybody too late.
Yeah, you're fine.
So anyway, so I chose the insurance route, which was a little less steady income because I was on commission and really but I thought it was the best place to learn. And from there, I pivoted and went to work at Appalachian Regional Healthcare, which was the first hospital system in the country. Before that, this ARH is what it was called, they were innovators in how you did hospital systems and connected groups so that you could share resources and that kind of thing. So I went to work for them and was willing to go to, drive all over Timbuktu, Eastern Kentucky and West Virginia and Northwest or Northeast Knoxville and Northeast Tennessee. But what happened was then I took a job with a group called Continental Medical Systems, which was rehab hospitals. And when I worked there, I was in business development, and so I was calling on physicians and hospitals, trying to make sure that they understood what we could do to help patients and how to make how to help patients find the right way to us. And during that time, Lindsey, you'll get a kick out of this. My CEO said, "Hey, Kim, you understand insurance. Can you figure out this managed care thing?" And so I mean, that was kind of how it started. And that was 1988. So that's where I used all my Center brainiacness, which is the ability to think about something that doesn't seem to be related and doesn't seem to make sense, and to make sense of it and make a path toward it. So that's what I've always been able to do, and really be able to use my critical thinking skills that Center always provided for me. The other thing that so I've just kind of stayed in that vein in healthcare administration. Working for a small hospital, I would say, gave me a lot of opportunity to interconnect with all the different departments and all these different physicians that I never would have gotten if I had gone to work directly for a big hospital system. So I did work for the big hospital system in Louisville, and I would ask questions in meetings, and people were like, "What did you do?" And I'm like, everything, everything. I did everything. And so, because you got questions about admissions, you got questions about length of stay, you got questions about payment. You understand everything, all the pieces that are admin that are not clinical. So I always stay away from the clinical piece. So I did that for several years as an employee, and then I forged out and became a consultant contractor and did projects for CEOs of hospital systems and healthcare plans. Primarily what I always would tell CEOs was that most of the time they know where they want to go, and they just don't have enough people to help them figure out so what does that mean I got to do tomorrow to make this plan happen? And that's what I was good at. I was saying, okay, I see your vision. Let's get everybody lined up. You start this, you start this, you start that. And those are the kinds of projects that I did for years. I ended up going to work for one of my clients. I was like, oh, I need to come work for you. And he was like, so we kind of, it was one of those things where I had been not an employee for a long time. And then I became an employee. So that happened in 2003. I worked with him for 3 or 4 years, went back to consulting, and then I joined him back in 2007 with Confluent Health, which is who I work for now. And I'm the executive vice president. I oversee all of the business development, all marketing. So business development meaning all the ways we help patients find us. We operate physical therapy clinics in about 25 states. We have about 800, 900 physical therapists in about 300 clinics. And so we help all of the physicians who send patients to us figure out why they should be sending them to us and where the best places to go are. So I oversee all that. I oversee all the digital piece that goes into that, all the work that we do to communicate with patients and insurance companies, anybody like that. And then I, overseeing, like I said, managed care, all the contracts. So if you are new to healthcare, what you may not know is that there's a contract between every doctor and every health plan that has to be in place, and then they have to get credentialed underneath that in order for them to see you and to bill your insurance company for it. So that's basically what undergirds managed care. And then that way the health plans can help to manage the costs that are coming down, and they can negotiate those rates, et cetera. So that's what I do. It's a lot of fun. I've got about 10 folks that manage the digital piece in Louisville, Kentucky. And before COVID, we had about 45 field marketing folks who stretched from Providence, Rhode Island to Florida to Seattle. That number is about 25, 27 now, because that was the one thing. They can't get into the doctor's offices. And we've moved a lot to digital. So it's a really growing, thriving group. It's a lot of fun. We're in big acquisition mode. We are venture capital based, which is interesting. So, and I've just had some folks come do some strategic work with us. And they said, they were like, we have never been in an organization where everybody talks about the culture and how fun it is and how much opportunity there is to work here. So it's a really transparent culture. It's a lot of fun. Our CEO is a clinician, so he's a physical therapist, which I don't even know how to work for a CEO that is not a clinical person, because I want to make sure that we're all doing things for the right reasons. So the other thing I did, just to make real quick, is I didn't go to graduate school until very late. So when I was helping my son look to go to college, I was like, I want to go back to school. So I went back to graduate school when he started college. So I graduated from I got a master's in public health from University of Louisville in 2013. So I started in 2009, and I was like in there with all the 25-year-old whippersnappers taking biostatistics and everything. I was like, I can do this. So anyway, so it was a lot of fun. It kept me young, and I had so many young, wonderful friends to work with. And I hired a few of them too, because I was doing consulting at that time. So they always liked to do projects with me because I would pay them for the projects. But anyway, good work. I'm happy to talk to anybody about what they want to do, what they see themselves doing, and I'm happy to make introductions if it makes sense that I might know somebody that could help. So that's my story.
All right. Well, Lindsey McCreary, I live in Knoxville, Tennessee. And I graduated from Center with a behavioral neuroscience degree and a minor in biology. The class of 2011 was actually the first behavioral neuroscience group before the think the degree was called like psychobiology or something to that effect. But after I graduated from Center, I actually worked at Center in one of the fellow positions in the student life office. And when I first graduated college with my neuroscience degree, I thought I wanted to be an event planner, which is why I took on that role. I thought it would be great experience. From Center, I moved back to Knoxville and worked for a nonprofit where I was also doing event planning. But in addition to that, I was doing fundraising for the organization. And through the fundraising, I really found a passion for the more presentation side of my job. So particularly in that role, I was talking to donors that were giving large sums of money to this nonprofit. And I really enjoyed kind of the challenge of requesting money for essentially nothing in return. Because I mean, more or less, that's what you're asking for in nonprofit fundraising. And so knowing that really was the portion of my role I found the most enjoyment out of, I started looking into other avenues to take my career. And I ended up in sales, and that led me to healthcare sales. And so in particular, I work for a company called Team Health. Team Health is the nation's largest physician practice. And so we have contract oversight for the services within both acute and post-acute healthcare systems and facilities. So for instance, if you go into Lexington, most of the Baptist hospitals in Lexington, their emergency medicine physicians are actually Team Health physicians that are contracted to the hospital. And our organization does all of the recruiting, the billing, and all of the back office stuff for the hospital. It really with the mindset that it allows clinicians to focus on their clinical work, and then we do all of the kind of non-clinical support. And so it's really allows physicians that work for us to focus on the clinical side and not on the other stuff that they may not enjoy as much. But really, as kind of a higher level of that, looking particularly at healthcare administration, there really is so many avenues that you can explore here. And Kim and I were talking a little bit about that when we first began our discussion, but I work in business development. So I am talking to hospitals who currently don't work with our organization or work with our organization in one service line and are interested in another. And I'm building customized proposals collaboratively with our operational team to that really fit the unique needs of each community that we're working in. But through my work, I'm also working with non-clinical operators, so individuals that perhaps have a master's in health administration, or maybe nursing professionals that no longer want to practice clinically and enjoy more of the operational work. And so I work collaboratively with them. We have a robust finance department that of course helps with budgeting for all of our contracts across the country. We have professional recruiters who are spending every day reaching out to young people who are just getting out of their residency programs. Of course, we have that, the C-suite. We have a CEO and a COO that run the day in and day out of our organization. And so really for healthcare administration as a whole, I would just like to say I greatly enjoy the business development side, but there are so many avenues to explore. And getting in an organization like Kim's or like Team Health, there's really so many opportunities to explore different facets of healthcare administration. The other thing that I would just really like to highlight is within healthcare, even if you're on the non-clinical side, having empathy and being able to talk to people face to face, being able to build relationships is so important. And so for anyone who is interested in a career within healthcare administration, I would just really encourage you, any opportunity that you have to improve skills for things such as this. It would be great to be doing this face-to-face, but having these Zoom calls, being able to really have deep conversations with individuals about, for my job, it's about communities all over the country, but if you're looking at working for a hospital or a health system, really being able to have deep conversations around the needs of a community and being able to be collaborative with clinicians on solutions for the community. It takes a great amount of effort on really focusing on those people skills. And I'm a millennial, so we get blamed much as anybody younger than me does. We get a lot of flack for not being able to communicate well over the phone or being able to communicate well on platforms like this. So any opportunity you can take to be a little better in that area, I think is really important for success in this, in healthcare administration. The only other thing that I'll highlight, and then I'll be quiet, is exactly what Kim said about doing her advanced degree later in life. As you can hear by my quick story on my career path, I had no clue really what I wanted to do after school. And so it really would have been, it really would have made it more challenging to figure out what I wanted to do in my career if I had gone directly into a master's program. And we're all center grads here. We know there's a lot of people who immediately go to law school or immediately go to medical school right after center. But I would just really emphasize, if you're not sure what you want to do, in my opinion, you're better off kind of exploring career fields before you really commit to that graduate degree. I got an MBA last year and I did it while I was working. And so I was able to pay for it as I went. And I was really able to feel 100% confident when I did it. I was doing it for the career that I knew I wanted. So that's kind of it for me. I'm happy to answer any questions.
And I can chime in on that, Lindsay. All of my papers, 100% of my papers I was writing about real things. I would call in friends and going, hey, you got anything you want me to research? I have to write a paper on program evaluation. Hey, you want to, and so then they got the use out of it. Occasionally I would bill somebody for it. And then, but it was really, really fun to have that broad base that you could it was real stuff that you were writing about. So
yeah. Absolutely.
Well, thanks, you guys. Do any of the students have any questions for Lindsay or Kim? And don't be shy, because now's the time to ask them.
Should we look at the chat? Because sometimes people don't like to.
I can ask a question. So I'm a senior and I was pre-med and I've taken all the courses, but now I'm really thinking about a lot of the injustices in the healthcare system. And I was just wondering, like, how you guys found things interesting and just kind of, you talked about your career path and how you came to this, but I'm interested to know just kind of more of how you feel like we should look into this as a possible career.
Yeah, so I think there's so many people in the healthcare sector that are looking at disparities in health and how to solve that. And I do certainly think that looking at that hospital administration side is a really great way, if that's something you're passionate about, to try to make an impact in that area. As far as starting off your career, I would just say there's so many places to explore. So for me personally, I'm working at a physician practice, but there's also hospital systems, and I know Kim has much more extensive background, so I'll be quiet and let her talk about some of the areas that she's worked in too. But there's a lot of roles at a hospital level. So let's say you're really passionate about the area that you grew up in and you're hopeful to work in the health system, specifically in your hometown or specifically in a certain area. There's so many non-clinical roles at those hospitals that really tackle those disparities in health. And I'll give one example from my work. So one of the service lines that I focus on is OBGYN services. And my organization specifically takes care of the what we define as unassigned patients within OB. And so typically those are individuals in a lower socioeconomic status that don't have health care or don't have access to healthcare. And so we're helping those women who are coming into the hospital who maybe have not seen a healthcare provider until the day they are delivering. And so though I don't directly work, of course, on the clinical side, the program that I help build is really looking at tackling the pregnant patient population that's most at risk for adverse health outcomes. And we certainly see that there are great disparities within women of color within that particular service line. And so a lot of what I can actually do, even though I am in essence a salesperson, is I can help build a program that best tackles that, that really huge problem that we're having in healthcare, and listening to what a lot of these healthcare leaders want when they're looking at my company for a program. We can actually learn from them too, to build things like drills and simulations within our program that better help nurses be prepared for those hard births and things like that. And so really, as far as like looking for jobs, I would say look at hospital systems in the area that you want to live. Look at companies like Team Health, other physician practices, and really just be open to maybe your the role that you're looking at, the role that's the entry-level job doesn't directly impact some of these disparities, but know that if you're with the right company, any role will help make an impact.
Yeah, and I would add, Lily, you might look at the Medicaid managed care plans. So Kentucky, I don't know if you're from Kentucky or not, but Kentucky and most states have Medicaid managed care. So you can actually work for Medicaid for the state health within the state system. But most of the time, Medicaid, what they do is they contract with managed care players, which are run, managed care companies, which are insurance companies basically, to manage it for them. So what they do is they pay a flat fee per person that's on Medicaid to that payer. And then the payer has to get people enrolled and make sure that they're getting all of the care that they need. And then they're incentivized to help that patient get what they need within, so that there's a margin right there. And so like Kentucky has 4 or 5 different ones. North Carolina is just getting ready to move into that. As a matter of fact, I think that happens in 2021, North Carolina, which would be a fun place to live and work too. So those are where, they are looking for ways to help populations to manage their health, to get people into care earlier. And so looking at, substance use disorder, issues of other social determinants of health. I mean, there's a ton, of course. And if you're really interested in that, like a master's in public health would just, like, you just eat it up. I mean, it would get you all so ingrained in all this and understanding why things have happened, how they've happened, what we can do about it. And then how we can make those changes.
And Lily, particularly if you're job searching, looking for any role that has the phrase population health in it is probably really what you're looking for if you're looking for those disparities in healthcare.
Mm-hmm.
Yeah, I am from Lexington, and Kim, it's funny you say that. I am currently applying to MPH programs. So
Okay.
but I'm also trying to look at possibilities for gap year or just having more exposure to the field. Yeah.
And I mean, I waited to go to school till late. I mean, I tell people, I'm like, if you can get it over and get it done, like, it's like going to college. Sometimes it's just kind of go over and get it done. But on the flip side, some of the young folks that I went to MPH school with, I mean, they were right out of college or a year or two. Several of them were wanting to go to med school. So they did this in the interim, which I just think, oh my goodness, so much schooling for them. But what a way to expose yourself to a whole lot of different venues and a whole lot of different languages. And then you've got biostatistics, you've got epidemiology, which are the 2 languages of health. And then you've got the other disciplines. So you kind of understand where you could fit in health behaviors, or if you're going to fit into more administration and policy, or like occupational health and environmental health. I mean, there's it's just like anything else. Lindsay said, you walk in, you think it's a pretty narrow door, and you go in, you're like, oh my goodness, there's a million things. So it's good stuff.
Thank you.
We have about 4 more minutes. Do we have any more questions from students? Okay. Well, if not, Lindsay, Kim, do you all have any last minute remarks that you would like to make to the students before we head out of here?
Well, one more remark, because I want to think that
Yeah.
as part of my MPH, I started a not-for-profit. And so, which is now 6 years old, and we're now at like a $250,000 budget, have 3 employees. And I was like, oh my goodness. But Lily, just FYI, that program is called choose-well.org. And what we do is we help anchor young families, primarily women-led families, in safe, affordable housing while they are maintaining their sobriety. So they have new sobriety. They're maintaining new sobriety for the children's first 5 years to really help change those behaviors and habits. So even if you are doing, like my work is obviously to keep people off of opioids when we're doing physical therapy and pain and all those kinds of things. So there's lots of good stuff there. But even when you are doing work that might be considered paid work, I was counseling this other young woman yesterday, is, you can be doing this other work on the side that can help fulfill kind of that mission to change the world too. So anyway, there's always lots of options and opportunities and ways to do it. Don't hesitate to reach out if you need anything else.
And the only other thing I would add is I had a lot of success in my career early on and really getting where I wanted to be through networking. And I know that is such a cliche word, but wherever you end up after center, I highly recommend getting involved in organizations within the community. For instance, in Knoxville, I'm a member of Young Professionals of Knoxville, which has about 300 members. And I actually got an intro to my first boss at Team Health because of a connection I made in that organization. I've met several people in the community through nonprofit endeavors. I work I'm on a nonprofit board, and so have been able to meet several other individuals in the community that aren't just young professionals, people that I see more as mentors and people who can help connect me with kind of my next step in my career. And so any opportunity you have to network, even if your next step is graduate school, I still think it's very important to network within the community that you're going to be in, because that's really the best way to ensure that you're opening yourself up to all opportunities. I would have never ended up at my company if I hadn't met a friend first that worked at this organization. So I really just highly encourage you, no matter where you end up, to kind of seek out some opportunities like that.
Well, thank you, Kim. Thank you, Lindsay, so much. That was amazing advice for the students, and I'm sure that they all enjoyed it. I know I did. Well, I hope everyone has a wonderful day, and thank you so much for our speakers for speaking today and the students who have come, and I hope everybody enjoys their holidays this season.
Bye, you too.
Thank you all.
Thank you.